Members, time has elapsed for non-government business, and we now move to private members' business. Standing in the name of the Honourable Peter Foster. The Honourable Peter Foster.
Deputy President, I move that this House, 1, acknowledges that the issue of mental health is everyone's business, that all employers, workers, communities and governments must take responsibility for shaping a society in which good mental health is prioritised. 2, notes that many intrinsic factors, including work, workplace culture, home, environmental, social, sexual, ethnic minority and economic status make some people more likely to experience poorer mental health outcomes. 3, notes that the McGowan government has invested an additional $495 million in the 2021-2022 budget to new and ongoing mental health services. And 4, acknowledges that those recent investments in mental health will benefit many people with mental health issues and continue to provide high-quality mental health care outcomes for anyone who needs it.
Members, the question is the motion be agreed. The Honourable Peter Foster.
Thank you, Deputy President. Mental ill health affects every Western Australian, either directly or indirectly through our families, our colleagues, friends or the people we love. As some members may recall during my inaugural speech, I briefly talked about my own mental health struggles with depression and anxiety. It is something which I live with every single day. I know that I am not alone and that I'm sure that there are some members in this place who have their own mental health stories to tell. Mental health does not discriminate, and while 1 in 5 of us will experience mental illness this year, some people will not receive the treatment or support they need because right across the country, our mental health systems have not kept pace with our needs. As a result, too many people will experience physical or mental distress, trauma, disruption to education or employment, relationship breakdowns, or the loss of opportunities. Some people are more likely to experience mental health problems than others, including young people, single-parent families, those who are unemployed, homeless or at the risk of homelessness, Aboriginal and Torres Strait Islander people and members of the LGBTQIA+ community. Multiple factors can adversely affect mental health, including biological, environmental and social factors. And while there is a greater understanding that being mentally unwell is real, mental illness is still stigmatised. Stigma stops people from seeking the help they need and can reduce the effectiveness of the care they ultimately receive. Improving mental health and well-being is a key enabler for people to participate in their community and society and live a productive and fulfilling life. It is also a key driver for a stronger economy. The cost to the Australian economy is huge. The Australian Productivity Commission reports that $70 billion a year is lost due to mental illness and suicide, and a whopping and largely avoidable cost of approximately $150 billion a year is associated with diminished health and a reduced life expectancy for those living with mental illness. These costs are enormous, not just in numbers, but in the very personal loss borne by those with lived experience of poor mental health and those who care for them. Deputy President, we've come a long way in recent years, acknowledging more people are seeking help, support and treatment for their mental health. This government has been working closely with the WA Health and Mental Health Commission to respond to the challenge that confronts us all. This year, the budget delivered a record $495 million boost to mental health and alcohol and other drug services. This is to be applauded. Equally as important is the significant work that is being done to make sure those dollars are spent in places where they can have the most impact. So important is reducing the number of deaths by suicide. Last year, there were 381 registered deaths by suicide in Western Australia. Despite this being a decrease from previous years, it is still the 4th highest suicide rate in the country. On average, approximately 1 person each day dies by suicide. It is the leading cause of death for young people aged 15 to 24. And FIFO workers are at substantially increased risk of poor mental health than other workers. They have higher levels of psychological distress, worse levels of burnout, and more frequent suicidal thoughts than other workers. Here in Western Australia, the government recognises that suicide prevention is a whole of community issue and recognise a whole of community response. Last year, we released the WA Suicide Prevention Framework, providing a roadmap for government, communities and other key stakeholders to work together so that a coordinated approach can be taken to support suicide prevention efforts across WA. This includes a $9.8 million commitment over 4 years to reduce Aboriginal suicide rates, using a region-by-region approach through development and implement the first Aboriginal-specific suicide prevention strategy in WA. We do this because we know that suicide can be prevented. It is complex, and many factors and pathways can lead to a person to attempt to take their life. But there is one message I want everyone to take away from this place today, that suicide is preventable. Mental health workplaces have come about as a result of recognising that mental health is a workplace safety issue and that preventing mental health harm is a legal obligation of employers. Led by the Mental Health Commission and the Department of Mines, Industry Regulation and Safety, this work educates employers and workers on what a mentally healthy workplace looks like, taking into account the design of the workplace culture, the physical environment and the facilities provided. And this is endorsed by the 2019 Mentally Healthy Workplaces Code of Practice for FIFO workers in the resource and construction sector. Improvements in Aboriginal health are being boosted by $17.6 million investment into social and emotional wellbeing services across the regions and a $9.2 million to extend the Strong Spirit, Strong Mind public education program statewide. The Strong Spirit, Strong Mind program has been hugely beneficial in the metropolitan region, both from an education and a workforce training perspective. I am really pleased that this will be rolled out across regional WA. The safe havens in Kununurra and in Perth are making a difference to people in distress, working alongside the emergency department, providing peer-based support for people who may otherwise attend the ED, but don't need intensive clinical and medical support. Step Up, Step Down services support people to safely stay in the community, close to their personal supports, family and friends, by providing short-term residential support and individualised care. These services exist in Perth, but also in Bunbury, Albany, Geraldton and Kalgoorlie, with new services planned for regional WA in Karratha, Broome and South Hedland, as well as youth-specific services. The government's record budget investment also contains an additional $311 million for community-supported accommodation and supports across WA, including $135.7 million for delivering outpatient treatment services to help people avoid hospitalisation and get the treatment and care they need in community closer to home. Deputy President, before I finish my contribution, I want to acknowledge some of those who work with the resources industry and FIFO workers to provide counselling and resources in the mental health space. Reverend John Dim is a bush chaplain with Frontier Services, an agency of the Uniting Church, and is based in Tom Price, where I live. His remit being the Pilbara region. Since 2013, he has been travelling to remote mine sites across the region, delivering counselling, pastoral care and responding to crisis, in addition to his religious duties. The Rev, as we call him, takes many phone calls on a daily basis from those in need and spends much of his time on the road in the vast Pilbara region. Nothing is too much trouble for the Rev, and he will often spend hours with a client to encourage them to change their life. Not all interactions, unfortunately, have good outcomes, and unfortunately the Rev has responded to mine site sudden deaths and to be called upon to conduct last rites. Taken directly from the Uniting Church website, quote, "We do what we do for the love of helping people. Helping people is human nature. If I can help anyone, I will, even if it's just a smile and saying howdy. Frontier Services is about making life connection between people, a telephone call and a chat, a friendly face, a listening ear, a helping hand. It's called mateship, and it happens on an emotional, a physical and a spiritual level, end quote. Thank you to the Rev for all that you do across the Pilbara. I would also like to acknowledge the work of Happiness Co. Founded by Julian Pace, who was a finalist in this year's WA Mental Health Awards, Happiness Co was inspired by the devastating loss of his father and his best friend, both unfortunately taking their own lives. Following his own road back to happiness, Julian brought Happiness Co to life in 2017, and he has made it his mission to make the world a happier place. Their vision is to reduce the impact that unhappiness, depression and anxiety have on our community. Happiness Co run online and in-person workshops and provide mental health resources and planning tools to help the community find their happy. They also run FIFO happiness programs which focus on wellness activations, toolbox meetings, manager development and on-site peer support training. Happiness Co have worked with over 150,000 individuals to date and have recently launched their wellness vending machine, which dispenses a range of practical tools and products that can be used to help improve well-being, general health and happiness into workplaces. Happiness Co held their Happiness Gala recently on Saturday night, and I had the opportunity to attend with the Minister for Mental Health and the member for Scarborough, who is a strong advocate in the FIFO mental health space. Happiness Co fundraised over $120,000 on the evening, with the funds going towards Blue Tree Project, the Fathering Project and Happiness Co. Lastly, I want to talk about a recent Chamber of Minerals and Energy, CME, and Lifeline initiative called Resourceful Minds, which was recently launched on October 19. The pilot commenced earlier this year on 12th of July and is a targeted peer support program to help remote mining operations in WA. Resourceful Minds is focused on peer support and acknowledges that remote operations in the WA resource sector operate as their own communities, with workers spending extended periods of time with their teammates and often forming strong relationships with them over a short period of time. Within every on-site community, there are go-to people that are often sought out for a chat and to provide emotional support for someone going through a tough time. Resourceful Minds seeks to equip those people, affectionately known as minders, with the skills and tools to better support and navigate those conversations and know where to go for help. Virtual training and coaching sessions will be delivered by Lifeline's highly trained telephone crisis supporters. The pilot is currently underway at Roy Hill, Mineral Resources, Simcoa and Woodside. The program pilot will be assessed in early 2022, with a broader rollout expected later in the year. I applaud CME and the resource industry and Lifeline for their support of this initiative that will help foster mentally healthy workplaces that supports its people. Deputy President, so much is being done, but there is still so much more to be done. Providing more holistic, community-based care with a focus on prevention and education will change people's lives. It is only through a shared vision and working together that we can achieve the change that is required. It is only by working together, supporting a whole of community approach, that we can truly change people's lives for the better. Mental health affects 1 in 5, and yes, we should be all talking about it, because I believe mental health really is everyone's business.
Members, the question is the motion be agreed. The Honourable Peter Collier.
Thanks, Deputy President. I stand on behalf of the...
With 4 minutes left, I give the call back to the Honourable Peter Foster.
Thank you, Acting President. In closing, firstly, I would like to acknowledge all members who have contributed to my motion before the House today, and acknowledging that the issue of mental health is everyone's business, but to also acknowledge the investments in the sector and also the good work of many organisations who are working in the sector. As I mentioned in my speech, suicide is preventable. One person, sadly in WA, takes their life every day, and so I hope my takeaway for everybody is that, suicide is quite a big issue in our community, and, let's all try and tackle that together. I would like to acknowledge the Honourable Peter Collier for his contribution, in particular acknowledging the complexity of modern day society, the issues of drug and alcohol as a contributing factor to mental health, domestic violence, bullying, and you mentioned about technology. Social media is a perfect example of that. Many of us have social media accounts, Facebook, Twitter, Instagram, Snapchat, and there's quite a lot of nastiness that takes place on there. Even with my own profiles, I'm forever having to hide and delete comments. Being a member of the LGBTIQ+ community, you get an extra bundle of joy of messages in the inbox. So, thank you for acknowledging that. Also, it was interesting to learn about, hear you talk about frontline services and PTSD and Soldiers and Sirens. I had the pleasure of attending the WA PTSD Research Foundation breakfast a few months ago. And for those who are unsure, jump on their website. They're doing great work in PTSD research in WA. One thing I didn't know was before this foundation only started this year, there was actually no research being done in WA. So get behind the PTSD Research Foundation. I want to acknowledge the contribution for the Minister for Mental Health. It is great that $1.1 billion was put in the 2021-2022 state budget. Quite a large sum of money that will go towards services. And also it was interesting to hear him talk about the emphasis on acute care to stop people from ending up in hospitals. We all know that, hospital ED departments are quite a busy place, quite a loud place. And when someone's suffering a mental health episode, they don't really want to be at the ED. It was also interesting to hear him talk about the work being done in the infant, child and adolescent space for the 0 to 18-year-olds. He acknowledged that there hasn't been a lot of work done in this area and that it's definitely a focus for him as Minister to do a lot more work, especially for our younger children, primary school and high school age. They also suffer mental health issues, in particular anxiety. It was also interesting to note the work being done with Greylands, the Reconfiguration and Forensic Task Force. Had to write that down because I wasn't sure what the letters stood for. And he also talked a lot about the work being done in regional WA. Like myself, the Minister for Mental Health represents a regional area, so it's good to know that there's a lot of work being done to, make sure that people in the regional areas can access the same level of service so that they can be home with their families, with their support networks on the road to recovery. I want to acknowledge the contributions of the Honourable Clara Andrich. In particular, she talked about young people and the economic impact, and that it's our employers' responsibility just as much as government and the community to step up to support their workers. And I also want to thank you for sharing your personal story in regards to your postpartum depression and anxiety. I think it's really important that that those who suffer mental health issues should be visible and should talk about it. We need to break down the stigma. As I said, 1 in 5 suffer mental health issues, and a lot of people suffer in silence, and by sharing your story, you end up finding that it starts conversations. I want to acknowledge the contribution of the Honourable Stephen Pratt, in particular talking about the role that everyone plays in having a conversation and checking in with each other and looking out for worrying signs, and your acknowledgement of Kendall White and the Blue Tree Project. She was awarded WA Young Australian of the Year for acknowledging her good work with the Blue Tree Project.
Thank you, Honourable Member. The time has lapsed for that motion, and we return to the orders of the day. Speaker of the Leader of the House.
Thanks, Acting President. I move without notice that orders of the day numbers 1 and 3 be taken after order of the day number 11.
The question is orders 1 and 3 be taken after order of the day number 11. All of those of that opinion say aye. Aye. Any against? And that is carried.